In years past, a patient who had diabetes could face a good chance of losing a limb, but that is not the case anymore. There are so many new advances, and I'm at Johnston Medical Center in the Therapeutic Wound Center to learn more about them, talking with Angela Fortson. And you have these hyperbaric chambers back here that you use for a lot of wound care with diabetes patients, don't you?
Correct, yes.
Tell me how they work.
Well, basically, oxygen has been proven to provide healing for patients. And this is a wonderful environment for that. When patients go into our hyperbaric chambers, they basically are exposed to 100% purified oxygen under pressure. And what that means is the oxygen is forced by pressure into the cells and tissues of the patient's body, which really enhances their ability for healing.
You see a lot of diabetes patients. Why is that such a big part of your...
This area, I mean, Eastern North Carolina, there's so much diabetes in this area, and not just diabetes, but uncontrolled diabetes. So we really, we see other patients as well that have, different types of wounds, but probably more than anything, we see diabetic wounds.
When I was little, I had members of my family who had diabetes and lost limbs, and I didn't really understand what the connection was between limb loss and diabetes. But diabetes can really have a negative impact on your entire body, can't it?
Yes, absolutely. It can affect many organs of your body, and if you catch injuries early, you have a better chance of getting it healed up and preventing amputations, but you really have to stay on top of it when you have diabetes.
So a lot of people with diabetes, they lose sensation in their limbs,
Absolutely.
Right? So they can end up injuring themselves and not know it?
Sometimes we've had several patients that come in and they'll have an injury to the bottom of their foot and they really have no idea how it happened or how long it's been there. And so that's why we really encourage our diabetics to check their feet or have a family member to check their feet. It's very important.
You have a pretty good success rate here, don't you?
Absolutely. We have over 94% heal rate right now, and the national average is around 80%, so we're very proud of that.
So diabetes doesn't mean you're going to have a life of pain and limb loss. I mean, there are so many things that have changed.
Absolutely. It's just really important for patients to be compliant with their treatment plan and to really work closely with the doctors and the nurses and follow the plan of care. Make sure that their sugars are in the right area. I mean, a lot of times their glucose may be uncontrolled. So they need to check their sugar every day and make sure they take their medicine and eat the appropriate diet, and those things are so important.
And speaking of your doctors and nurses, you have some really committed folks who work closely with the patients who come to visit them.
We have 7 different physicians on our staff, and basically each physician is assigned a nurse that works with that doctor, and each week they see the same set of patients. So they really become familiar with those particular patients and follow them extremely closely until they're healed.
Well, it has been great to learn about it. Thank you so much.
Thank you.
If you would like more details about Johnston Health, just visit them on the web. The address is johnstonhealth.org.